So ASCO 2020 is going to be a really exciting meeting, and we have, one really very interesting data set being presented in the area of mesothelioma, and this is the Italian RAMES trial. Here, this is a randomized phase 2 trial in which patients who'd completed first-line chemotherapy were randomized either to maintenance gemcitabine or gemcitabine with ramucirumab. Now, we'd seen a progression-free survival benefit previously, and here ASCO, according to the abstract, we now have an overall survival benefit as well. So I, for one, am very much looking forward to the granularity around this data. And this is an important data set because having had very little advances in mesothelioma for many years, we're suddenly now potentially seeing big changes. This is a positive randomized phase 2. This may or may not change the way we perceive treatments in mesothelioma. But recently, Bristol Myers Squibb released a press release around their first line trial, Checkmate 743. In that trial, patients who had untreated mesothelioma were randomized to receive either cisplatin or carboplatin pemetrexed or nivolumab ipilimumab. And the primary endpoint of the study was overall survival, and the press release from BMS has confirmed that this is a positive study. Now, this study is not being presented at ASCO. We will hear about it at some stage later in the year, I hope. But knowing that that's coming really makes us think very carefully about how we're evaluating our treatments for patients with mesothelioma. I do think there are exciting times ahead in mesothelioma.